Here we have a patient who's all set to go home. It's been a week post rhinoplasty. She is associated with the hospital since a very long time. She has been a previous patient for cleft lip, palate. She has also undergone AMD, which is an anterior maxillary distraction, for her hypoplastic maxilla. Now she has come for a rhinoplasty, so this is a cleft rhinoplasty case. We'll proceed with the splint removal for her today.
Sarah.
There's still a lot of swelling because it's only been a week. Yeah, so we have to clean the sides, remove the stitches. Michelle, you can have a look at yourself. We'll also show you her previous pictures. She had a cleft on the left side. So she had a depression over here, you can appreciate in the pictures. We've tried correcting that. A lot of cleaning is still left. She will get rid of the stitches as well today. From that side, you can also have a look at the mirror. The basal view. Look at it. So we've tried working on this. The left nerve is completely depressed. We've tried working on it. Hers has been open rhinoplasty with rib. We've tried working on the dorsum, giving her aesthetic lines. If you can see this picture, which you can appreciate in the mirror, you can also slightly turn your head towards the left. You see there was barely any projection. We have tried working on it. We have tried working on the dorsum, giving her a nice tip. Cleft rhinoplasties always happen to be challenging, but we've tried giving as much aesthetic contouring, high projection as possible. Yeah. There's a little bit of swelling here, okay, because it's been a week. We'll clear all this off. The stitches will also be removed today for you. Okay. You can appreciate the results better once the swelling comes down.